We're coming into the fall season, so if you're a woman who's pregnant, have a newborn, a child with a chronic illness, or a senior citizen, it's really important you stay for the rest of this talk. So let's talk about RSV, respiratory syncytial virus. For those of you not in those groups that we spoke about, don't worry about it. It's really just a cold. You've probably had it 20 times. But for infants and people with respiratory illnesses, it can really be very severe. And the problem is, there's no treatment. So the only reason we even test for it is for hospitalization purposes. And it's in fact included in a lot of the tests that test for COVID. But for those groups we talked about before, pregnant women, newborn, senior citizens, there are new preventative things we can do. In fact, there are vaccines and long-acting monoclonal antibodies that we're using to prevent these illnesses in those groups. So let's talk about the newborns. Beautiful. The newborns that are born during the RSV season, which is from October to April, should get something called Beyfortus, which they call an RSV vaccine. But in fact, it's not a vaccine. Beyfortus is a long-acting monoclonal antibody, so it's just protection for that season. They're going to offer it to your baby while you're still in the hospital, because when they're youngest, that's when they're in the most danger for serious infection and hospitalization. So Beyfortus, or nirsevimab, decreased hospitalizations in infants 50 to 74% last RSV season. That's unbelievable. I'm sure this could be scary for some parents when their baby's being born, that they'll be offered what they think is a vaccine in the newborn period. But truthfully, this could save your child's life. Pregnant mothers can get an actual vaccine for RSV during the later terms of their pregnancy. So giving the vaccine to someone who's pregnant then passes the antibodies from the mother to the baby and thus protects the baby during that season. You really only need this vaccine one time, one pregnancy, and the babies only get it that first season. Nice birdie. So the other group of people this is important for is senior citizens, because RSV can predispose you to getting secondary bacterial infections like pneumonia. Come on, work harder. So there's also a similar vaccine for people over 65. Oh, your hand is dirty. For most of us, RSV is just a cold. But for infants and senior citizens, it can be devastating. Ask your provider, whether you're pregnant, have an infant, or over the age of 65, how you can get preventative measures to save you this season. Thanks for your help. Okay, Doris, give me the finger. Not that finger. Side note, if you have children you want more information about RSV, healthychildren.org from the American Academy of Pediatrics has a webinar this Friday, September 19th, and excellent information on their site about RSV.